COVID-19 has caused devastation throughout the world. The best way to combat this deadly and infectious disease is to utilize the vaccine that has been developed. We must overcome the hesitancy by some of the population by dispelling misinformation. The COVID 19 vaccine effectively reduces the number of COVID 19 cases because it helps combat severe illness and death, and therefore everyone should be receiving it. The vaccine is meant to prevent contracting COVID 19 and make it less harmful if infected. Vaccines have been a weapon used to battle dangerous diseases throughout our history. Some of the illnesses we have fought against are polio, smallpox, hepatitis, measles, flu, and many others. The newly developed COVID 19 vaccine has been added to this list. People have been awaiting the COVID 19 vaccine since the virus became more prevalent in March of 2020. Mandatory vaccination is justifiable because it saves lives and will keep borders, shops, and services open. Even though many people are willing to get vaccinated, there are still people refusing to do so. The CDC explains how the COVID-19 vaccine has undergone and will continue to undergo the most intense safety monitoring in U.S. history. There has been significant evidence proving that these COVID-19 vaccines are safe and effective. Before recommending COVID-19 vaccination for children and adults, scientists conducted clinical trials. As a result, the FDA gave the Pfizer-BioNTech COVID-19 vaccine emergency authorization to use in children ages 5 through 15 years old, and full approval to use in people ages 15 years and older. Some people are nervous about getting the vaccine because they heard about specific side effects. Still, the CDC heavily reports how some people do not have side effects from the vaccine, and some report to have some that may affect their daily activities, but these side effects will go away within a few days. Another stigma associated with the vaccine is how it can cause infertility problems. The infertility rumor is simply not true because there has been no evidence of such sort, and most women have not had any issue of getting pregnant within the last couple months. The CDC provides us with information that promotes the COVID-19 vaccination acceptance. Being forced to receive a vaccine invokes an emotional response from citizens against being mandated to do so. They feel that mandates violate their civil rights and liberties. The ACLU posted their intake on the subject. In fact, far from compromising civil liberties, vaccine mandates further civil liberties. They protect the most vulnerable among us, including people with disabilities and fragile immune systems, children too young to be vaccinated, and communities of color hit hard by the disease. The main argument against receiving the vaccine is that it was developed too quickly, but this is simply false because COVID-19 itself was developed too quickly. Still, clinical trials to examine safety and efficacy are not rushed at all, says Dr. Cunningham. Henry Ford Health System staff posted 10 rumors about the COVID-19 vaccine that are proven untrue by doctors. And the one that stuck out to me the most, the most at being false, is how the vaccine can lead to long-term effects. Dr. Cunningham expresses how people believe that there are components in these vaccines that will have a lasting impact. But he explains that side effects would occur within minutes or hours of receiving it. Another main one that you probably hear from a lot of anti-vaxxers is saying, "I've already had COVID-19, so I don't need to get vaccinated." This is bothersome because data shows that vaccines provide better protection against the COVID-19 variants than natural immunity after infection. Doctors say that after you have had COVID-19, natural protection from your antibodies do have adequate that protection is or how long it will last. Therefore, the most effective defense against COVID-19 is being vaccinated so that you have a high chance of not getting it again. In a peer-reviewed journal written by Emily A. Largent, she talks about how the United States public will act towards COVID-19 vaccine and its mandates. She opens with how the U.S. should assess the accessibility of the COVID-19 vaccine mandate. In this article published in December of 2020, mandates should be used only if COVID-19 continues to not be contained and to continue to grow. As many of us know, a new outbreak occurred this past summer due to the Delta variant becoming stronger and causing more numbers to rise. Individuals who are likely to get a COVID 19 vaccine accepted mandates at higher rates than those not likely to do so, which was 73.6% for adults. This shows that most people are willing to get it, but not everyone. Another critical factor is mandating the vaccine on employees so they do not spread it, and 65% of people were for that. In another peer-reviewed journal in April of 2020 by Bridget J. Kelly, writes how public health workers have reacted to the mandating vaccines. Currently, the government is trying to strategize about vaccine promotions to increase willingness among those who may be hesitant. 75% of respondents were willing to get the vaccine themselves, and 73% of respondents were ready to get the vaccine for their children. In addition, 85% of people over the age of 65 are more likely to get vaccinated, and 75% of people ages 50 through 64 are likely to get vaccinated. This shows that older people are more willing to get vaccinated compared to younger groups of people. Most Americans are ready to get vaccinated, but it's the very few vulnerable people in this country that are holding us back from eradicating this virus. The vaccine will only help us move on with our lives. There is growing evidence that fully vaccinated people will be less likely to be infected and develop symptoms and are at reduced risk for severe illness and death from severe COVID 19. These vaccines will only boost your immune system and make your body recognize and fight this awful virus that has caused our country so much pain these past 2 years.